ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੇ ਪ੍ਰੀਮੀਅਰ ਡੇਵਿਡ ਈਬੀ ਅਤੇ ਸਿਹਤ ਮੰਤਰੀ ਐਡਨੀਅਰ ਡਿਕਸ ਵੈਂਕੂਵਰ ਵਿੱਚ ਇੱਕ ਨਿਊਜ਼ ਕਾਨਫਰੰਸ ਕੀਤੀ ਗਈ ਤੇ ਨਾਲ ਹੀ ਇਸ ਮੌਕੇ ਪ੍ਰੀਮੀਅਰ ਨੇ ਐਲਾਨ ਕੀਤਾ ਕਿ ਸੂਬਾਈ ਸਿਹਤ ਸੰਭਾਲ ਕਰਮਚਾਰੀਆਂ ਨੂੰ ਮਜ਼ਬੂਤ ਕਰਨ ਦੇ ਲਈ ਅੰਤਰਰਾਸ਼ਟਰੀ ਪੱਧਰ ਤੇ ਪੜ੍ਹੀਆਂ ਲਿਖੀਆਂ ਨਰਸਾਂ ਦੇ ਲਈ ਅਰਜ਼ੀਆਂ ਅਤੇ ਮੁਲਾਂਕਣ ਫੀਸਾਂ ਮੁਆਫ ਕਰ ਦਿੱਤੀਆਂ ਜਾਣਗੀਆਂ। ਪ੍ਰੀਮੀਅਰ ਈਬੀ ਨੇ ਕਿਹਾ ਕਿ ਸਰਕਾਰ ਅੰਤਰਰਾਸ਼ਟਰੀ ਪੱਧਰ ਤੇ ਸਿਖਲਾਈ ਪ੍ਰਾਪਤ ਨਰਸਾਂ ਲਈ ਹੋਰ ਅਰਜ਼ੀਆਂ ਦਾ ਮੁਲਾਂਕਣ ਕਰਨ ਲਈ ਇੱਕ ਨਵਾਂ ਮਾਰਗ ਸਥਾਪਿਤ ਕਰਨ ਲਈ $1.3 ਮਿਲੀਅਨ ਦਾ ਨਿਵੇਸ਼ ਕੀਤਾ ਜਾਵੇਗਾ।
For nurses, and that's why we're here today. I'm pleased to announce new supports in a faster assessment pathway that will get more nurses working in BC's healthcare system faster. For nurses returning to practice, there will be help with the costs of re-entering the workforce. These are nurses who may have taken a break for practice for any number of reasons and want to come back but are facing financial or other barriers to coming back. We want to support them in coming back to work. This includes application and assessment fee support, along with travel expenses support. Additionally, bursaries of up to $10,000 available for any additional education that those nurses need who are coming back to practice in order to be able to get to work. For internationally trained nurses, we've committed $1.3 million to set up a new pathway to streamline the licensing process. This will help our partners, the BC College of Nurses and Midwives, and the Nursing Community Assessment Service assess more applications faster. Now, what is that going to mean in real terms for British Columbians? Well, right now, candidates in this scenario are waiting 3 years to be granted registration. Our goal is to bring it down with these reforms to between 4 to 9 months. We also want to reduce any potential financial barriers. So we had grants for internationally educated nurses, but those nurses had to pay those grants up front and then be reimbursed later. So now our government will be covering over $3,700 up front in application and assessment fees for internationally trained nurses, so that application fee does not stand in the way of them practicing in British Columbia. The bottom line is this: whether a nurse was trained in our province or not, we're ready to welcome those who are ready to care for British Columbians. Today's announcement continues our ongoing work to support more internationally educated nurses in British Columbia. Some numbers: since April 2022, a total of 5,500 nurses have said that they want to work in BC. 2,000 are in the registration and assessment process right now. More than 90% of applications were received after our government's initial actions to welcome internationally educated nurses into our healthcare system. There is still much work ahead of us, but I'm optimistic about the impact that these changes will have in a very real way for British Columbians.